Moving along on the bladder channel, we'll move down to bladder 21, which is going to be just lateral to the caudal border of T13. And so if we imagine sort of the rib cage and where that last rib would be coming up to meet us, that's about where we would be looking at T13. So just lateral to the caudal border of its spinous process is where bladder 21 would reside. And it's going to be in between the iliocostalis and the longissimus erector spinae muscles are, paraspinal muscles. So that's about where I'm estimating our bladder 21. One vertebral space cranial to that, or one soon cranial to that, would be where we reach bladder 20, which is associated with our T12. And then just in front of that, bladder 19 and bladder 18. And bladder 18 is lateral to the caudal border of the spinous process of T10, which makes sense because if we sort of estimate this is where our T5 was, this is where our T10 is, I could probably be going a bit further caudal, looking at sort of the differences in the space there. But so the other points here, once we have bladder 21, is we're going to want to find bladder 23, bladder 22, and bladder 52. So imagining again where the extent of the ribs reside, instead of following the vertebrae up, we would just take a parallel line with the end of that last rib up. And that's how we find the L2, which is associated with bladder 23. This is going to be lateral to the caudal border of the spinous process of L2, also between those two muscles there. So we pop those guys in about there. And so we've got bladder 23, bladder 21. So filling in that space at the level of L1 will be bladder 22. That's just easier to find when working back from bladder 23 based on palpating sort of dorsally from the last rib. So the last point in this video will be bladder 52, and that's going to be on the outer bladder line, in line with bladder 23, but it'll be on the lateral aspect of the iliocostalis muscle, and that's kind of going to be the rim, like the ridge of muscle at which you fall off from. So just kind of if I was palpating, okay, here's the intermuscular groove between longissimus and iliocostalis. This would be iliocostalis, and just going lateral to that is where we would find bladder 52 on our outer bladder line. So that's what we did here.